Obsessive-compulsive disorder is the topic for this video, and obsessive-compulsive disorder is a psychiatric disorder, and basically would like to explain what it is by breaking it up into two parts. The first part is the obsessions, and the second part is the compulsions. That's why it's called obsessive-compulsive. Well, this happens first. An obsession is basically an idea or an image or an impulse that happens in the mind of the patient, and these thoughts are often thoughts that cause stress to the patient. What are they about? Well, they could be a wide variety of things. These ideas or images or thoughts may be about some sort of harm or some sort of risk, some sort of danger. Contamination is a big one. You'll see that a little later on. Contamination, maybe loss of some sort. And these ideas cause significant stress or anxiety in the patient, and distress also. So how does the patient respond? They respond with a compulsion. And the reason they respond with a compulsion is they believe that this will neutralize that anxiety or that distress that is being caused by these ideas. Let's give an example. So let's say a person has repetitive obsessions that every time they touch something, they're being contaminated. Okay? Significant distress this is causing them, and anxiety. So they respond with a compulsion because they believe that this compulsion will neutralize that obsession. And the obsession we're talking about in this example is contamination. So what is the compulsion that they do? Repetitive hand washing. Okay, they'll wash their hands 40 times a day. And that is an example of a behavior or an act. And that repetitive hand washing is an example of a behavior or act which they do to reduce the stress or prevent a situation. Now in this case, they're doing it to reduce the stress and anxiety that was caused in their mind because of this fear of contamination. So I hope that made sense. I'll give you another example. Let's say the person has an obsession, a repetitive idea in their mind or an impulse that their door is always unlocked, like when they leave home in the morning, that their door is they've left it unlocked, and that they feel that it's the risk of some burglary or something like that. So this causes them significant distress throughout the day. That, oh my God, I left my door unlocked or whatever, and they're always, it never goes away. So they respond. This obsession that's going in their mind, they respond with a compulsion, and they believe that this compulsion will neutralize this obsession. So what's a compulsion? Checking the locks. So they may check the lock 5 times in the morning before they go to work. They may even come home on their lunch break to check the lock. They may even call somebody to say, can you go over and check the lock? When they come back home at the end of the day, they may check the lock even though they're at home. The idea is that they are so distressed by this obsession that they need to perform a compulsion in order to neutralize that obsession. And the compulsion that we just talked about is constant lock checking. So that's a behavior or act. And the hope is that that will reduce the stress that's caused by this idea in their mind. So that's a little bit about basic introduction to obsessive-compulsive disorder, which is abbreviated OCD. Now, we talked about hand washing and checking locks, and there's other types of compulsions. Some of them are mental, meaning they only happen in their minds, and some of them are silent, meaning they're only happening, nobody can see them, nobody can hear them. Maybe they have to repeat something, they have to repeat something under their breath, words, or they have to count, or they have to maybe even pray, So there's a lot of compulsions that a person can have based on obsessions. So that's a very, very brief sort of introduction. So how do you diagnose this? Well, we talked about the symptoms. We talked about a couple of examples of symptoms. Now, the diagnosis, there's no real test. It's really just based on history. So really what you do is you talk to the patient and you sort of look at what's going on, and you break it in, of course, just like I did before, into two categories. You've got the obsessions and the compulsions. So first what you do is you analyze does this patient have these type of recurrent and persistent images or ideas that are constantly causing the patient distress and anxiety, causing distress or anxiety. And this can be assessed by an interview and talking to the patient. And if the patient is indeed experiencing these types of ideas and images that are causing significant distress and anxiety, that's the first part of OCD, okay? And that is going to trigger the next part, which is trying to do something to neutralize these obsessions. Now, the compulsions are the acts or the behaviors that they then do. I've got the Canadian spelling of behavior with the extra added U, just in case you're wondering why I keep putting the U in there. So what are some examples of compulsions? Well, we talked about them, these are done in order to neutralize the significant anxiety and distress caused by these obsessions. One more example. So let's say a patient has an obsession that they're just not pious enough, and that their piety is very low. They're just not religious enough. And that idea is causing them significant distress and anxiety. So the person responds with a compulsion. And the compulsion is something they need to do in order to reduce or neutralize this stress. Now, what is an example of a compulsion? Maybe praying. And they pray, multiple times a day. But they need to do it in order to neutralize the distress and anxiety that they're experiencing from these ideas. So as you can see, it's a pretty significant psychiatric disorder. So how do you treat it? Well, the treatment, there's two parts. There's medications and then there's therapy. And the medications, there's a TCA, which is very, very popular, tricyclic antidepressant, and it's clomipramine. Okay, this is always on the licensing exams, so remember that one. And then there's the SSRIs, which are serotonin selective reuptake inhibitors. You all remember those. They're actually antidepressants, but they're used in the treatment of OCD. And there's 4 that are used, not all together, of course. I mean, there's 4 that you can choose from. There's fluoxetine, there's fluvoxamine. Okay, remember these: sertraline and paroxetine. Okay. Now, so remember these. It's very important to remember these drugs. Now, therapy. What is therapy? What type of therapy are we talking about? Well, it's a very unique type of therapy. It's called exposure and ritual prevention. And I'll explain what this is. So what you do is you expose the patient to what they are afraid of or what's causing them distress. So for example, if their ideas, those obsessions involve contamination, what you do is you expose them to contamination. And with time, what you do is you allow the patient to slowly diminish those compulsions. So for example, before the therapy started, the patient has obsessions of contaminations that cause significant anxiety, and as a result the patient washes their hands 50 times a day. Okay? Well, in exposure and ritual prevention, what you do is you expose them to the contamination, but then with time, what you do is you allow the patient to forego the rituals, meaning you allow them the opportunity to lessen the compulsions. So as this therapy progresses, they may only wash their hands 30 times a day, and then they're exposed to contamination, and then they may only wash it 20 times a day. So you see what's happening? Eventually, over time, the anxiety that's provoked by the contamination lessens, and as a result, their desire to do those compulsions, which in this case is hand washing, also lessens. So that's this exposure and ritual prevention. All right, finally, I'd like to finish off with a clinical vignette. And here we go. So a 27-year-old woman complains to her doctor that she is in danger of losing her job. She states that she is late to work almost every day because before she leaves for work, she must check all of the faucets to make sure the water is turned off. She also needs to repeatedly check to make sure that her stove is off. When she is finally ready to leave, she returns from her car several times to ensure that her doors and windows are locked. Which of the following drugs will her physician most likely prescribe? Okay, well, this is OCD. Remember, this the obsession in this case is fear. She's got fear that that all the doors are unlocked. And then the compulsion, okay, which is the response to neutralize the anxiety and distress caused by the obsession. The compulsion in this case is lock checking. Okay, that's why it's called obsessive-compulsive disorder. Well, we just talked about this. Which one of these five? Well, it's this one right here. It's a tricyclic antidepressant.